What's different about this vaccine versus the traditional vaccines that we've seen in the past is that instead of taking an actual COVID virus and changing something about it, we didn't take it and expose it to radiation and kill it. We didn't take it and heat it up to the point that it can't live and then inject it. We didn't do anything like that. We literally created those spikes on the outside. The simplest term, it's a message. We take the mRNA, we take that message, and we are injecting our body with that message. And we are teaching our body how to make that protein. When your immune system sees that spike protein, which it's seen before because you've been vaccinated, you will mount your protection. You will be able to fight the disease before it causes you to have the respiratory problems, the trouble breathing, the increased risk of having the clots, and even destruction to lung tissue. So the vaccines that we have on the market currently available, the Pfizer vaccine and the Moderna vaccine, are both 2-dose vaccines. The reason they're a second dose is because in studies they showed that 1 dose was not necessarily protecting a lot of people. And that means that even if you receive your first dose, you are still at risk of getting the infection. We tell people, even if you've gotten your first dose of COVID, you have to continue to wear your mask and do your social distancing and keep your hand hygiene and just keep your level of awareness and protection up, because that first dose may not necessarily protect you. In regard to any time they have any kind of what we call flu-like symptoms. The flu-like symptoms are body aches, fever, chills. Those symptoms are our immune system trying to protect itself. Their body's being more active. It's making more proteins, it's running a higher temperature. The signs that our immune system has been exposed to something and now is generating that response. And you will also see that with the COVID vaccine, because again, we want that immune response. We want our body to start saying, okay, start making the proteins and the things we need to protect ourselves against COVID. We want symptoms, we want a reaction, and we want an adaptation, a change to happen. We live in an age where there's so much information and not necessarily all of it's good information. And so a lot of that hesitation comes from people that may not necessarily know if what they've gotten is good information and can they trust what they've gotten. And so I get a lot of questions on mostly what are my thoughts on the vaccine and do I think it's safe? And I tell people before I go into a long spiel, I said the short answer is we recommend it. Okay, we recommend it because worst case scenario, someone had a severe allergic reaction and we had to take them downstairs to the ER and we had to put them in the hospital to make sure they continued only to do better. We can still treat that better than we can treat COVID. The vaccine's new, but so is COVID. And that's why people are scared and want the vaccine, but that's also why people are scared and don't necessarily want the vaccine. In any discussion about any vaccine, I want to know where their apprehension is. I want to know what questions they have. And I want to know if it's a misinformation that I can correct for them and help them make a more informed decision.